Hi, my name is Jim Collins, president of CardiologyCoder.com, owner of CardiologyBiller.com. This public service announcement will educate physicians about the government's current regulatory focus on dual chamber pacemaker implants and primary prevention defibrillator implants. Through the Recovery Audit Contractor Initiative, the government is outsourcing the auditing of an alarming percentage of pacemaker and defibrillator implants. The government established a national coverage determination for pacemakers, which specified that symptomatic bradycardia only justifies the implantation of a single chamber device. In order to justify the implant of a dual chamber device, the operative report has to justify why a dual chamber device is preferable over a single chamber device. Four indications for dual chamber devices were outlined. The first specified that if the patient had a definite drop in blood pressure, retrograde conduction, or discomfort after ventricular pacing was initiated, then a dual chamber device would be indicated. It also specified that if the patient had either known or anticipated pacemaker syndrome, or if the physician anticipates that a slight increase in cardiac efficiency would importantly improve the patient's quality of life, that a dual chamber device was indicated. Fortunately, the government identified that other uses of pacing technology would be appropriate as long as more conclusive clinical evidence is available. More conclusive clinical evidence was recognized but not specifically outlined. Fortunately, the National Institutes for Clinical Excellence, also known as NICE, has a technology appraisal assessing these specific indications. Technology Appraisal 88 specifies that if a patient has sixth sinus syndrome or AV block, in addition to symptomatic bradycardia, that dual chamber pacing is preferable. I've identified that the most advantageous way to respond to Medicare audits for pacemaker implants is to provide them with a hard copy of the National Coverage Determination, a hard copy of the NICE Technology Appraisal 88, and to provide a cover letter connecting the dots between the National Coverage Determination, Technology Appraisal 88, and the operative report. The ideal pacemaker report would indicate that the patient's receiving a pacemaker because they have symptomatic bradycardia, and that they're receiving a dual chamber device because they also have either sixth sinus syndrome or AV block. The National Coverage Determination for defibrillators dates back to 2005 and is far more confusing and contradictory than pacemaker indications. The defibrillator policy specifies that patients only qualify for a single chamber device unless the documentation justifies the use of a dual chamber device. In addition to sixth sinus syndrome and/or AV block, another common indication for the use of a dual chamber defibrillator over a single chamber defibrillator is if the doctor wishes to discriminate against atrial fibrillation with a rapid ventricular response against ventricular tachycardia. Make sure the documentation clearly illustrates why the patient needs a dual chamber defibrillator rather than a single chamber defibrillator. The main focus of government auditors when looking at defibrillator implants has to do with the three wait periods that are outlined in the National Coverage Determination. The first two wait periods apply to all 7 of the primary prevention indications. They specify that if a patient has a myocardial infarction, they're precluded from receiving a primary prevention device for a period of 40 days. If the patient receives any form of revascularization, whether it be angioplasty, atherectomy, stent placement, or coronary artery bypass grafting, they're precluded from receiving a primary prevention defibrillator for a period of 3 months. The third wait period in the National Coverage Determination for defibrillators specifies that patients with non-ischemic dilated cardiomyopathy must wait for a period of 9 months before receiving a primary prevention defibrillator implant. However, indication number 9 specifies that these patients only have to wait for 3 months if they're enrolled in a Medicare recognized data registry. Since the National Coverage Determination requires that all primary prevention defibrillator implants be enrolled in the National Data Registry, the effective wait period for all of these non-ischemic patients is truly 3 months instead of 9 months. The obscurity of this third wait period has unnecessarily delayed the referral of thousands of patients for device implants. By understanding the nuances I've outlined, you'll be able to avoid penalty for the overwhelming majority of device implants. Whether you outsource your billing or prefer to have it done in-house, I hope you'll keep me in mind for your future needs. CardiologyCoder.com is a membership organization exclusively open to in-house cardiology coders. We provide education via newsletters, web conferences, and proactive compliance audits. For information about membership qualifications and current dues, please visit cardiologycoder.com. Cardiologybiller.com is the most proficient way possible to achieve and maintain best practice approaches to cardiology billing. We use proprietary techniques to capture necessary demographic and charge capture data. Our team of over 80 US-based billers promptly submit claims, initiate the appeals process, and secure patient liability. We proactively educate providers, we file appeals for inappropriately denied services, and we respond to all government auditors on your behalf. Our fee is anywhere between 5% and 6.5% of receipts. Please contact me if you would like a personalized quote. You can contact me via email at jim@cardiologybiller.com. Thank you for considering these two options. I hope to hear from you soon.